Well, good morning, everybody. My name's Cecilia McClure, and I'm the Community and Engagement Manager for Scotland and Northern Ireland at the charity. So the Celts, if you like. I hope you're all well this Tuesday morning, and it's good to see so many of you here. This morning, we're going to be covering a subject that can be quite fraught with difficulty because it's probably one of the toughest decisions you would ever have to make in your life. And that's about which care home you put your parents or whoever it is that you're looking after into. So it's about choosing the right care home, the right sort of care for them, and paying for it. And we have an expert in the field here who is going to be able to answer a lot of your queries. For example, is this the right care home for my mother or father? Do they come up to a reasonable standard? Where's the money actually going, for example? So today I'm delighted to introduce Debbie Harris, and she's from Autumna. She's the founder of Autumna, and she's going to be giving us a real eye-opener into this subject, and I hope you enjoy it. Thanks very much.
Hi, my name is Debbie Harris, and I'm the founder and managing director of Autumna. And today I'd like to talk through how we can support you or an elderly loved one in navigating the social care system as it currently operates in the UK. So what I want to do is to cover the factors that will help you in your decision making, and there's quite a few things to think about. I also want to cover why the credibility of the information you're using really matters now more than ever, how Autumna can support you and your loved ones, and I'm also going to just talk about the self-funding landscape. So if you're paying for your own care, how that's changing and the impact referral fees are having in that space. Quite important, that one. I'm also going to take a quick look at hospital discharge challenges. It's a big issue. And finally, an introduction to OpenScore, which is a quality indicator for care homes. We estimate that over 95% of the decision-making process by a family that is paying for their own care and looking for a care home now takes place online. That's a lot of time you're spending online. The personal recommendations historically relied upon are disappearing, and increasingly we're seeing care providers promote themselves very robustly online in response to the way people are searching. Now, don't get me wrong, I'm definitely in favour of some of the benefits this online information brings, and I'll discuss some of that in a minute. But the difficulty you as a care seeker might face is that some care providers can have very big marketing budgets, making them appear to be the only show in town. And that can be really misleading. So you need to be careful, and I'm going to give you a few ideas on how you can support that. So one area is, you'll have seen one of the teasers we sent out for this talk, and it was, if you are recommended a care home for your dad, is anyone earning a hidden commission? So as a result of this changing provider and online search behaviour, there has been a huge growth in online platforms who make their money from referral fee driven recommendations. And this referral fee is very often hidden. Unless you ask, you're very unlikely to be told. So always ask, what is the referral fee? What are you getting the referral fee for? So whether you're searching online or using an online platform, how can you be confident that the information you use is credible and in your best interest, rather than being influenced by a referral fee? In other words, is the choice you make the right one for your loved one, or frankly benefiting somebody who's getting paid £200 or £300? For me, the answer comes down to two things: trust in the advice you are given and transparency in that information. I've always passionately believed in these two things, trust and transparency. I mean, let's face it, they're critical in every area, but particularly so when you are looking at social care. And it's so important to make sure that you trust that information when you are trying to make an informed decision about care. With the growth of online searches and the unknown influence of AI, and let's face it, it is still very unknown, I think trust and transparency will become quite simply crucial when families are looking for care. I actually think it doesn't matter whether or not you're looking for care or looking for anything, trust and transparency is going to become important in everything. At Autumna, we always put the care seeker first. We always put you first. We are not owned by any care providers. We are not owned by any venture capitalists. Our business model does not rely on any sort of referral fee or commission payment. And so we can provide you trusted, unbiased information so that you can be confident you're making the right choice. Before I go on, I want to talk you through the 3 key factors you need to consider when you are looking, and I'm going to focus here on care homes. When you're looking for a care home, in many ways, when you're looking for a home care provider, it's actually a similar criteria except for location, but it will give you an overview of all of the different factors that you need to be considering, because I appreciate for many people this is the first time you will have ever considered care. You've probably never been into a care home before. That's certainly the position I was in 15 years ago when I was looking for an aunt, and the reason I've started to do this. So I'm going to focus on a care home search, and these are the 3 things that, to start with, you've absolutely got to nail. So the first one is location, and I mean, it's obvious that the care home needs to be in the right location, but you'd be surprised how many families overlook the fact that the location you choose needs to be nearest the person most likely to visit. And this might not be where your relative currently lives. If your relative lives 3 hours away and you're the only person who's going to be visiting them, have the care home near you so you can pop in for a cup of tea. It's an obvious one, but it's one that's often overlooked. The second point is the type of care. Now, you may or may not know there are 3 fundamental types of care: residential care, nursing care, and dementia care. Residential care home is where somebody lives in the care home, they're fed, they have support with personal care, but they don't have any medical nursing needs, or if they do, a visiting nurse can support them. A nursing home is somebody who would need a nurse on site 24/7, so much more acute care needs. Very often in the nursing home also you'll see people who are not mobile, who aren't able to walk around, so they're in bed all the time. And then dementia care that actually crosses over both residential and nursing care. But whilst these care homes have got these distinct categories, they are actually, the lines are starting to blur. Residential homes are increasingly providing end-of-life care and edging into nursing care. And in addition to this, we're also seeing more homes specialising in complex care or support for dementias and perhaps challenging behaviour. So understanding the care needs and the behavioural support needed for your relative is really important to make sure that the care home you choose or the home care agency you choose is able to support your loved one for as long as possible. And then the third point is price. So obviously a big political topic, this one, but there are 4 types of funding. Self-funding. This is where the resident has the resources to pay for the care themselves, and you are paying for all of it. Local authority funding. Now, the threshold for this is if you are under £23,250 in England, is slightly different in the other areas. The local authority will, on a pro rata basis, down to I think it's 11 or 13,000, pay for all of your care. Then there is local authority funded with a top up. So a third party tops up the local authority fees. And there is also continuing healthcare. This is funded by the NHS. It's actually quite difficult to get. I think about 2% of people get CHC funding, and it is constantly reassessed. So clarity on your funding and how long it will last, and discussing this with the care home is really important, particularly with the financial pressures care homes are now finding themselves in. If they haven't budgeted for the resident to revert to local authority funding after, say, 6 months, 9 months, a year, then they may ask that relative to move to another care home, because the difference between a self-funding fee and a local authority fee can be very significant, very significant. So when we started to develop Autumna, and as I've already hinted at, we've built this because I was looking for a care home for an aunt. We realised one of the things we had to really clearly demonstrate that we could be trusted and that the information had to be transparent and clear. So our early challenge was really quite simple. Every registered care provider in the UK had to be listed on Autumna, all of them. Didn't matter whether they paid us or anything, they had to be listed on there so that people who were looking for care could find every option available. So we have built the UK's largest directory, and our goal is really simple. It's that every family should have access to and be aware of all care providers in order to make that informed decision. And that is what we're all about, that informed decision. But it's clearly not enough to know that a care home exists down the road. We're way beyond the likes of yellow pages now. The difference lies in the detail of the information and the ability to understand, and I use this term advisedly, the personality of the individual care home. Knowing the location, the type of care and the price is quite literally just the starting point, but unless you get those right, you're going to go up all sorts of rabbit holes. For somebody who's going to live in a care home, you need to be able to understand what makes that care home better than that care home. And we have built Autumna to support you with all of those nuances to help you find the right care. So as an example, the detail on the care homes that we have included covers care and behavioural support. We've already discussed the importance of understanding your care needs, the residential, the nursing and the dementia care. But you also, if somebody has dementia, you also need clear communication and understanding about somebody who might have challenging behaviour, because unless you know that's what you're looking for, and unless you can find it in the detail of on the profile of the care home, you're going to be calling up a lot of care homes who are simply unable to help you. So it's the ability to filter for that level of detail that we're supporting. Another area is the dietary needs and cultural preferences. This is another area we've really worked hard on at Autumna, because meal times, especially lunchtime in the middle of the day, are hugely significant to residents. As I said, we've done a lot of work on this, and you know, it was sparked by a client who was in hospital, who we were supporting to help the family find a care home, and this client refused to leave her hospital bed unless we could find her a care home that offered pie mash and liquor for lunch. Having worked out what pie mash and liquor was, because I didn't know, there are in fact 18 care homes in and around Maidstone who say they can offer pie mash and liquor for lunch. So we realised that this was a really significant thing we had to do, and working with the likes of Unilever and NHS nutritionalists, care providers, and other care seekers, we developed the only food certification available in care homes, and it's called Choice Dining, the big pink logo. But it's really to help you make that informed choice. It enables families to find care homes that offer serve the food your loved one wants to eat. It's really important, worth having a little dive into. But also the other nuances that help you decide whether that care home or that care home is the best one for your relative. Things like activities, pet policies, infection control might be really important. All have their own significance for residents, and they're all different. So we've included all of them in the profile. Personally, I would not live in a care home unless it had a dog. That's just me. And then finally, and the big one really, pricing. It's really imperative that pricing is accurate, up to date, and not misleading. And that's really all I need to say on that. It's very important. So when I'm talking about detail, I mean everything. What matters to you or your loved one to ensure living a good life and maintaining dignity. So I've described how we support families with the detailed directory, but there are in fact 4 ways we can help you. And I hope this is going to be useful for you. So we've got the directory. It's transparent, it's comprehensive, it's free to use. One way to think of it is it's right move for social care. But we've also, and that's what the little box is here, we've also got a care finding tool, and it is a quick way to shortlist suitable care providers. All you have to do is fill in a simple form with details about what you're looking for, and we guide you so that you give us the right information. And the tech in Autumna will find, filter, and create a shortlist of providers that match your bespoke requirements. We will then email these to you or whoever you want to receive them, giving you full details of the home or the home care service and asking the provider to make contact with you. This is a free to use service and can save you, believe me, an awful lot of time. Or the third one, you can call us. We are human people, and we are a team of experts you can trust. And we operate 7 days a week, and we are genuinely here to help. And this is also a free to use service. We also, the last one is Chosen with Care. This is a bespoke care finding service. It's the only service we charged for, and it's basically a hand-holding support, and it is often used when somebody is either out of the country and trying to find care for a relative in the UK, or when you're struggling with hospital discharge, or it's a really complex care home search. So they're slightly more unusual things. So I want to just talk you through a little bit about how the landscape it has changed since COVID, because there has been an enormously huge change in the way care is looked for, and it directly relates to the trust and transparency conversation I've been talking about. And so I just want to give you a few minutes and give you some background information so that you have a bit more of an understanding of this very complex and fragmented sector. As online searches become the de facto way people search for care, the sector, as with any other business, responds to that change. So let me give you some stats. There are 410,000 adult social care beds in the UK. Despite new homes being built, this figure has been pretty stagnant for about 15 years. So smaller care homes are being closed and larger ones are being built, but the number is roughly the same. Occupancy rates across care homes. You might often hear in the press there are the reason for delayed discharge coming out of hospital is there are no available care services. Well, occupancy rates in care homes are around 85 to 86%. It varies significantly across the country, and it varies enormously by care type and budget. But please don't let anybody tell you there are no care home beds. There absolutely are, when you know how to find them. Costs in care homes. We all hear how expensive social care is, but as in every business, costs are rising: wages, energy, food, national insurance, and this is leading to increased fees for self-funding clients. No other way to put it. The majority of whom, and there's no other way to put this either, are subsidising the local authority clients that are in a care home. Often the local authority is paying the care home less than the cost it takes to provide the care. It's a really challenging time. Providers are under pressure, and as a result, the self-funding market is very, very competitive. Self-funding clients are frankly very sought after. So if your relative is self-funding, paying for their own care, you have an opportunity to negotiate on fees. Another way to look at this, self-funding clients are holding the ace cards when looking for care. So do bear that in mind, and particularly if the care home that you are looking at has recently opened and there are a lot of available beds, there is a real opportunity there for negotiation of fees. It can take 2 years or more to fill a care home. So that might not be something you've thought about before. So I want to pause here to talk through referral fees, as this self-funding competition by the providers brings these very much to the fore. Is someone being paid a referral fee to recommend a care home to you? And if they are, can that ever truly be in your best interests? Unfortunately, referral fees are commonplace in the sector, and I'm going to state here right now, Autumna, we do not take referral fees. I have always felt that at some point the Daily Mail is going to realise that somebody's mum's contact details are being sold for £200 and it's going to be front page news. We've seen the scandal of referral fees with IFAs and car financing, and I think social care has the potential to be a very much bigger story. But I hope, speaking to me as the founder and our independence, you can see that you can trust the information we give you and know that we will act transparently and with integrity. Really matters. So far, we have covered the need for trusted and transparent information from a credible source of information, what to look for when choosing a care provider, and the importance of the detail about the care service when making a decision, the changing care landscape and the impact that is having on referral fees. But now I want to talk about hospital discharge and how this might really impact you and frankly the whole family. So this is another area I'm very passionate about, and we're becoming experts in this. Far too many of my relatives and clients that we work with have been stuck in what I'm calling the cycle of doom. Your relative is ready for discharge, but the discharge team can't find a care home. And then they're waiting for an assessment. They find a care home 3 weeks later. The assessment is no longer valid because your relative has become more confused, is no longer mobile, maybe malnourished. So they go back into the cycle of another assessment, waiting to find another care home bed. That might sound very dramatic, but unfortunately that is very commonplace. All the time, the patient is deteriorating. There is an estimated 10% muscle loss for every week spent in hospital, and at a certain age that is very difficult to regain. And of course there is a risk of infection. For the NHS, the cost of one night in a hospital bed when you don't need to be there is £400 a night. We frequently see it in the press as bed blocking. Bed blocking is costing the NHS £1 billion a year. The knock-on effect is pretty grim. When beds are being taken by patients who don't need to be there, there is a delay in A&E. Ambulances line up outside hospitals waiting to discharge patients into A&E, and ambulance response times are impacted. In addition, elective surgery is also affected because there are no hospital beds. The situation is dire, and I'll be honest, we work a lot with discharge teams, and I don't see any changes happening or improvements happening anytime soon. So we're working with many hospitals, as I said, across the country, supporting the discharge teams to find available care quickly. We're not working with enough of them to make enough of a difference. But the critical point, and the reason I'm telling you all of this, is if you have a relative in hospital, the key criteria is to get them out of hospital as quickly as possible and into the right care setting. It doesn't matter how challenging your search is, we will be able to support you. Just give my advice line team a ring and we will happily support you, but get them out of hospital. I'll just give you one quick case study of something. So a hospital approached us at the beginning of the year. They had a client who had been in hospital for a year, and the discharge team could not find a home that could support both his medical and his behavioural needs. The family were despairing because the hospital was a long way from where they lived, and understandably the patient was becoming actually institutionalised in the hospital. I spoke to the discharge team one lunchtime. We had a 30-minute call. He explained what the patient needed. We searched our platform with our care finding tool, and within 24 hours had identified 3 homes that were able to support the patient, and the patient was discharged 4 days later. The discharge team had been looking and failing to find a care home for a year, and it took us 4 days to find a solution and get him moved out. And I had an update a few months ago, and he's doing really well, which is great. But I guess what I'm trying to say is, don't necessarily rely on the discharge team. Try and find solutions for yourself. The key goal is, if you are ready for discharge, get your relative out of hospital. So the final point I want to talk about is the CQC. So another of the teasers about this presentation was, would you put your mum in a care home with a requires improvement rating from the government regulator? Well, what an interesting question. As I'm sure you're aware, the CQC, which is the only regulatory body for social care in England, is not fit for purpose, according to Wes Streeting. That's not me saying that, that is Wes Streeting saying that. So it's fair to say that the CQC is struggling. The average inspection cycle, so the average length of time that in between visits to a care home, is 4 years. And it is not unusual for us to see 7, 8, 9-year-old reports. And I've recently seen an outstanding CQC for a care home report that was 11 years old. The chances that this is an accurate assessment of that care is very, very remote. It's estimated, in fact, that the CQC will take 17 years to catch up on their reporting. So the lack of CQC, regular CQC inspections, is obviously impacting families, and it is impacting providers. For example, a provider with a requires improvement are waiting at least 3 years to be re-inspected, even though they've corrected everything that makes them that made them a requires improvement. So in answer to that question that we posed, would you put your mum in a care home with a requires improvement rating? It depends how old the CQC report is, because if it's over 6 months, frankly, it's pretty useless, because so much will have changed and potentially improved or not improved. So how, as a family, can you make that informed decision about the care when there is nothing to guide you on the quality of that care? Ultimately, it's the only thing that matters, the care. So to support families, we have developed the only real-time accreditation on the quality of care and service for care homes. And it's been developed with the support of consumers and social care who recognise the need for a data-driven solution to what is, at the moment, a failing system. And now this solution is called OpenScore. And you can see a little widget thing at the top there. It's only available at the moment for care homes, but we're working on home care as well. And we've got version 1 has launched, so this is new. It launched last year. It's already been used by over 3,000 care homes across the UK. And we've got 65 data points. We've pulled them all together and we've given the care home a score out of 10. It's data driven. And it's real-time insight into the quality of care and service, and it updates every 24 hours, a significant improvement from every 4 years. It also, and you can see that on the little 4.7 star thing there, it will also include live ratings from visitors to the home. This is a significant recent shift. I don't know if any of you've been in care homes or anything, but pre-COVID, you would use a paper book to sign in and sign out again. It's all about fire logs. People need, like in a hotel, you need to know who's in and who's not in. But during COVID, of course, everybody realised you can't disinfect a book. So digital sign-ins on iPads were introduced. And what we're seeing is that visitors are leaving a review. So these are people who have been in the care home that day, and they are leaving a review so that you can see what that army of people who are going in to that care home every day think about the care home. It's exactly what we want. We're also starting to see local authorities and ICBs use it in the absence of a CQC report, but it's a constant development, and I'd be very interested in anybody's views and feedback. So it's for you, this means it's real-time assurance about quality care, not relying on a very old rating. So it's a really important next step for people who are looking for care. So in conclusion, I think the ability to trust the source of your information will become increasingly important to get the best outcomes. And we can help you with Autumna's directory to access that transparent care data. You can use the care finding tool to build shortlists quickly and get providers to contact you. You can call on our bespoke service for complex cases, and you can leverage our hospital discharge support if you have a loved one in hospital. Please do use that because that's really important. And you can use OpenScore to reassure yourself that you're finding the right quality of care. And so, very finally, we've been supporting families and professionals for nearly 2 decades now. And our mission, as I'm sure I've said enough times already, is to empower you to make the best care choices. So please do reach out, tell us your challenges. And if you have any, come to us and we will support you, and we'd be delighted to. Thank you very much.
Debbie, thanks so much. That was so informative and really useful, I'm sure, for a lot of people. That's going to be really helpful. It was lovely to hear that you're available 7 days a week and that you have a human being at the end of the phone as well. Is really, really good. I'm sure people will be in touch. We've got a few questions coming in, so I'll put those to you if that's okay. So the first one that's come in, is there any advice, please, on when to look at nursing homes and get on the waiting list?
Yeah, really interesting question. So care homes do have waiting lists. So you can go on a waiting list. How effective they are is not very clear, really. So when a care home is, if I do it from the care home perspective, first of all, if a care home has an empty room, they are going to want to fill that room as quickly as possible. If somebody is on the waiting list and they might need a care home in 3 months, 2 months, whenever, then if somebody comes in before that, they will take the room. it really is about being almost immediate in your search. So if you think you're going to need a nursing home or a residential care home, I would advise doing the research early, identifying what your shortlist options are, and visiting the care homes, so that you have, you've got maybe 2 care homes that you really like, and then when you need them, you literally would be making contact a week or 2 weeks beforehand. Anything longer than that, and any available beds, the turnover, the movement of the beds, people going in for respite, etc., is just too fluid, and it's very, very difficult to predict, obviously.
Yeah. Okay, thank you. On the flip side of that, Deb, I know in the area where I live, I've heard of lots of people actually having to go out of the county because they've been told there aren't the care home spaces. Is there any advice on what people can do in those situations?
Okay, so this is very likely to be if somebody is local authority funded. So if the local authority is looking for your care, then they may have a framework of care homes that they work with. If they can't find an available bed within that framework, then they may have to extend the distance. However, and this goes back to my hospital discharge point, if the local authority is telling you that your mum needs to go to a care home 30 miles away, because they can't find anywhere nearby, speak to us, because I can almost guarantee we will be able to find a care home that will accept local authority funding that will be closer to you. It is a myth that there are no available beds within certain locations. There are.
Okay. Yeah, so for the people I've heard of recently, it's caused them an awful lot of distress.
Exactly. And to defend the discharge teams, it is quite simply because they don't have the tools available to them. It's why we're working with them, because we do have the tools available to them. They don't have the tools in order to do a whole of market search. And that's what you need to be able to do. You need to identify every little care home, not just the 5 or 6 you regularly speak to. It's really important.
Okay, thank you. Does your directory also include care and support to help someone with early stage dementia to continue to live reasonably independently at home?
Yes, it does. So on Autumna, we list every care home in the country. We list every registered home care and live-in care provider in the country. We also list quite a lot of the retirement living developments in the country as well. So which would be a sort of a supported independent living type of thing. But if somebody wanted to stay in their own home and they had early stage dementia, then I would suggest identifying a home care agency that would come in for maybe an hour or whatever is needed. But they basically come in on an hourly basis. Could I just flag here as well that if somebody is at home with dementia, early stage dementia, then there are a few key things that you might be worried about, and technology can step in here. So there is an awful lot of technology coming into the sector. So monitors, just sensor monitors, so that if dad hasn't got up one morning or his routine is interrupted or something. It just gives you little flags. I think you can also get sensors for the front door. You can also just have a little tracking device, whether you think that's the right thing or not. But if dad's getting lost, it might be quite useful to know where he is. So there's a lot of technology that can support as well.
Yeah, I hope you don't mind me saying as well, Debbie, that we also have a dementia support service, and people can actually go onto our website and book a call with one of the Admiral nurses, who are the specialist dementia nurses, so they can give lots of hints and tips about keeping people independently and safe at home. So yeah, that's just to let you know that's there if you do need it. So another question here is, how is Autumna funded?
Yeah, so very happy to answer that. So Autumna was originally funded by me. I put my money where my mouth is, and I put some money in, and I was match funded by our local council, who recognised that we needed some support to try and fix the problem of finding care. Our ongoing support is we are a subscription platform, so we list every registered provider on the platform for free. And then we say to them, if you would like to subscribe to Autumna, you can simply put more information about your service. And at a time, when everything is happening online, that is actually really valuable for the care provider, as well as valuable for the care seeker who is doing the searching online.
Yeah, no, that's great, thank you. Are there any particularly helpful questions, areas to ask about when visiting a care home, please?
That's a really interesting question. So one hopes by the time you've walked into the care home, you've identified, A, it's in the right location. Secondly, it offers the right type of care and it is within your budget. So hopefully you're not wasting your time going into a care home that you haven't already identified those three key areas. So you would make an appointment to go into a care home. Before COVID, people used to literally just drop in, unannounced, and you can still do that. But if you want to speak to the manager, and I would advise you do, then it's useful to make an appointment because she may be off doing assessments or wherever. So make an appointment, go in and see the care home, and the sorts of things I would be looking for is how friendly and personable you find the manager, because if you've got any problems in the future with that care home, that's the person you're going to be speaking to. So do you get on with the manager? When you're walking around, your senses are going to tell you whether or not you like the home. So does it smell? It shouldn't. It absolutely should not. Does it feel right? And only you will know that, knowing your relative. And I often use this analogy. I remember when I was looking for schools for my kids, and I remember walking into one school and thinking, this is the school for my daughter. And could I have actually pinpointed why? I don't think so. It just felt right. And that's the sort of feeling you will get. Other questions to ask. Ask about the food. So ask about dinner times, lunch times, in fact. Does everybody sit in the dining room? What time do they eat? And think about what your mum or your dad or your relative likes to eat. Supper time food as well is another one. If your mum prefers to eat in the evening, like my mum does, is there an opportunity to be able to do that? So it's the personal stuff. It's the feeling and the personal stuff, the personal questions that means that care home will fit what your relative is looking for. Does that help?
Yeah, that's really good. Thank you. Yeah. I think it's it's knowing the person, isn't it, and where they will fit. Because I've worked in many care homes in the past, and I've often thought myself, oh, if they did that to me, I'd be horrified. And I'm not saying I'm not talking about anything bad here. I'm just thinking about when people have activities and they've put hats on people and for Easter bonnet parades and things like that. And I thought, oh, if somebody did that to me, I'd be horrified. So it's knowing the person, isn't it? Because some people very happily go along and be involved.
And I sort of referenced in the presentation about the personality of the care home, and that is actually what you're talking about. Is it a happy, jolly, clappy, singy type of care home, or is it actually a little bit more sedate? And what is the personality of it, and would that fit your mum? I would actually add a caveat to this though, Linda, and we hear this a lot. So somebody said to me only last week, I don't need any activities in the care home. My mum has never done activities. She's a very private, very reserved person, and she's never done anything like that. She will probably just sit in her room and watch TV and read her books and listen to her music. Oh no, not a bit of it. Mum, turns out, is running the residents' society and leading the activities. So you just never know. You just never know.
We all change, don't we, as we go through life? So yeah, I know. I still haven't changed my mind about the Easter bonnet yet, but never say never. Thank you. So next question is, will Autumna become something that will be used in all care homes moving forward?
So Autumna works with all care homes. So we are available for all care homes. We list every care home. Open Score, which is the quality rating, yes. We've got 3,000 care homes that are currently using it, but yeah, we're going to be pushing it out to the whole of the sector. The sector needs it, but more importantly, people who are looking for care need it. How do you choose care if you don't know what the care is like? And I mean, when I say there is nothing available to other than Open Score, I actually mean nothing. It's the CQC or the regulator in Scotland, Wales, Northern Ireland, and it's just not there. It's just not. It's frightening.
And it's a minefield if you don't know your way around the care system. So no, I can see Autumna being so useful to people. Debbie, we're just getting a lot of comments about funding care, and where would you advise people to go to get that advice? Because I know, again, that's another minefield, is funding care.
It really is, and it's one of the three things you've absolutely got to nail. You have to understand whether or not you're self-funding. If you are self-funding, whether or not, how long that money is likely to last, and when you may or may not revert to being local authority funded. You also need to consider whether or not you top up mum's or dad's local authority funding fee. So let me just give you, I'm not a financial advisor. I would advise people to go to SOLA accredited advisors. So that's the Society of Later Life Advisors. And they are specialists in later life financial advice. So that's where I would suggest people went to get information. But it's really important you work this out. So if your relative lives at home and they do not have a dependent living at home with them, so if your mum is living with her dad and your mum with your dad and your mum needs a care home, then obviously the value of the family house is not included in her assets. But basically you're looking at her assets. If it is above £23,250 in her name, then she will be paying for her care. Now, depending on how much money she's got, depends on how long she will be paying for her care. And that's the bit you need to work out and be aware of when you start looking for a care home. If mum doesn't own her own house and doesn't have assets in excess of 23,250. That's in England, by the way. It's slightly different in other countries. So if mum doesn't have that amount of money and she will be local authority funded, and you look at some of the care homes that the local authority is presenting and it's 30 miles away and they won't consider anywhere else, for example, then you can say, as a family member, I will top up that local authority fee, and you can top it up to whatever level you like. And then you work with the local authority and you say, right, I'd actually like her to live, please, in the care home at the end of my road, and I will top up the balance of the fee. And those top ups can be anything from £50 to 500 or more a week.
Frightening amounts. Yeah. So we haven't got any more questions coming just now, Debbie, but can I just ask you if you have any words of advice for anybody that is going through this process? Because I know that I've, again, working with a lot of carers, that often we promise the people we care for that they won't go into a care home, and sometimes we can't keep those promises. and there's a lot of guilt and a lot of emotions around that. Do you have any little words of advice for people going through that process?
Yeah, it's the guilt. It's the guilt that gets you every time, isn't it?
Yeah.
I can honestly say that the majority of people we speak to, when they have made the decision, when they've done their research and they are confident that they have found the right care home, and they've introduced their relative in the best possible way, a respite stay early on for a week or two gives them a flavour of what it might be like. We often hear somebody who goes in for a 2-week respite stay actually decides they would like to stay. So that introducing it as a respite stay, mum, you can go home afterwards if you don't like it, is one way of introducing it. But I think if you've done your research and you've done your very best, and your relative can no longer stay at home for whatever the reason, you really have no alternative but to make this decision, then I think if you've done your research, don't feel guilty. I know it's easier said than done, and I know it's really difficult, but very often when we speak to families, when their relative has moved in, they see a real improvement in quality of life, in health, in eating, in social engagement. They feel safe, they're eating well, they've got people to talk to. So there's often a real improvement in quality of life. It's scary. The thought of going in is scary. That's why that respite option sometimes works quite well.
Yeah, it's a really good idea. And I think, we're quite unrealistic at times in that we think, that how can we as one person care for somebody 24/7? It really takes a team of people, doesn't it, to care for someone.
It really does.
Take a lot on, don't we? So, yeah.
It really does. And I think if the care is falling upon the shoulders of, in particular, one person, then that is not a long-term solution, because what we then find is that the carer has caring needs. Somebody needs to look after the carer. And what happens to the person they're caring for if they suddenly can't do it anymore, very quickly can't do it anymore? You need to be thinking ahead. You need to be putting in place little supports.
Yeah. We've got a couple coming now. Is there any advice on how to navigate with a care home if you feel needs are not being met for your loved one?
Yeah, very interesting question. First step would be speak to the manager. And that goes back to the point when you're looking around, make sure you get on with the manager, or feel you'd be able to get on with the manager. Be clear about what it is that you're unhappy about. I was about to say, and I don't think this is fair really, I was about to say and recognise the challenges that the care home is under as well, trying to meet everybody's needs and expectations. But actually, you're paying a lot of money. It's your mum. You don't really care what the reasons are, do you? You just want your mum to be happy. I would start with the manager. Start with the manager. The only other place you can escalate it is the CQC. Really.
Okay, thank you. And I'll just make this the last question now, Debbie. If receiving care at home are found difficult to arrange respite, is then care at home risk being stopped? Any advice?
Well, I would have thought that if you are working with a home care agency and you say that dad needs to have a couple of weeks of respite to give everybody else in the family a bit of a break, and you ask them to pause the care, then I think that is a perfectly reasonable request. And if you're giving them a little bit of notice, then I don't see why that couldn't be managed. The only difficulty, I guess, is whether or not the carer who's been coming in to see your dad is then put on somebody else, is then caring for somebody else, and you might get a new carer coming in. But you know, it's a bit like speaking to the manager of a care home when you've got a problem. Speak to the manager of the care agency and tell them what you're thinking of doing, and maybe even get them involved in what you're doing so that they feel that they're supporting you and you know, part of the arrangement. Speak to the manager.
Okay, thank you, Debbie. That's all for now, and I just want to thank you so much for such an informative session. I'll certainly be having a good look at Autumna myself, and you know, the team here at the charity will be having a look as well, so that we can signpost people appropriately. And thank you everybody for joining us today.